Hi friends, welcome to my video. Today we are going to discuss about the three important symptoms of a stroke. How to prevent or how to identify whether the person are going to this stroke. So don't skip this video, let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
What is a stroke? A stroke occurs when there is an interruption of a blood supply to your brain. So we can classify a stroke into two types. First one is ischemic and the second one is hemorrhagic stroke. Because this ischemic stroke will occur if there is any interruption of a blood supply to the brain due to a block. When it comes to hemorrhagic stroke, that will occur if there is any rupture of a blood vessels in the brain, which cause bleeding inside the brain. So you have to note that 80% of people will go for this ischemic stroke, and the remaining 20% of people will go for this hemorrhagic stroke. In this manner, we can classify the two types of stroke. And you also have to note that in earlier times, this stroke will mostly seen in older persons. But in this new generation, mainly this stroke will also seen in younger or adult also. So the trend of this stroke is changing day-to-day life. So that's why I am discussing about the three major symptoms of this stroke will helps to identify and can prevent the complications of this stroke. So we are going to discuss about the three major symptoms of a stroke. So what are the three major symptoms or three major signs of a stroke? So before going to this, you have to note a mnemonic called as FAST. FAST in the sense F stands for facial drifting, because most of the persons who are going or undergoing for a stroke will show the major symptoms called as facial drifting. So you can identify whether the person are going to stroke by this facial drifting. Facial drifting in the sense you have to ask the patient to just smile. During a smile, if you note any abnormality, just asymmetrical smiling, you have to ask you have to visit the nearby doctor in order to prevent the complications. So this facial drifting is the first common signs that will helps to identify whether the person is undergone for a stroke. So this is the first common symptom or the first major sign that helps to identify the stroke. And the second one is A. A stands for arm drifting. You have to ask the patient just to hold their arm in air for up to 10 seconds. In this manner, you have to ask the patient to hold their arm for 10 seconds. If they can hold for more than 10 seconds, that will helps to or that will indicates the patient is normal. But if he can't able to hold their arm less than 10 seconds, that indicates it's a sign of a stroke. So in this arm drifting, the patient's arm will be in this manner. He can't able to hold for more than 10 seconds. So this sign will also helps to identify or helps to help the patient to prevent the complications also. So you have to note that this arm drifting will be a major or the second most sign of a stroke. And the third common sign is S. S stands for slurring of a speech. Slurring of a speech indicates and how it will be diagnosed. Mainly, you have to ask the patient about their chief complaints. So while talking, you can able to notice in their speech method. So if you identify any slurring or any abnormality in their speech, this will also helps to identify whether the person are undergoing for this stroke. So these three symptoms will be helpful to identify and helpful to prevent the complications of a stroke, mainly a paralysis and even death also. When it comes to the treatment, you have to note the fourth thing of the mnemonic FAST. T stands for a time. Time is important factor for the treatment of a stroke. If you find any signs of a stroke, you can or you have to visit nearby doctor to prevent the complications, including paralysis and death. Because if you find the signs of a stroke at the right time, and if you admitted in the hospital within 3 hours, we can prevent the clotting of your blood and also prevent the damage to your brain. So in case of a ischemic stroke, the major part of the brain will be damaged. So you have to note that we can't able to reverse our brain to normal condition if it gone for any damage. That's why treatment or the time is important for the prevention or to maintain a proper treatment to prevent the complications. So that's all about this mnemonic. F stands for facial drifting and A stands for arm drifting and the S stands for slurring of speech and the T stands for time. If you find these three symptoms and if you maintain proper time management, you can prevent the symptoms and complications and even death also. That's all about today. Next day I will reach you with another topic. Thank you. Have a nice day.